If we just make things free, then all the poor people will finally get healthcare. Isn't that right? What was your idea of what US healthcare was like when you lived in Venezuela?
Well, I knew that it was going to be expensive, because everything that you heard about the US healthcare system is like it's going to be expensive, but it's going to be of high quality. But in some sense, it feels that all the stress that you had to go through with the payment stuff, the insurance companies, the paperwork, it goes in at the expense of what you should be treated.
People here are either insured by some federal program or some private insurance, and they are not paying them with their own pockets. They don't really care about the costs because someone else is paying for them.
If a third person is paying for something, they tend to be less discerning about what people are getting for their money.
This is not how free market works. Like if I went to a doctor the other day because I was having a lot of digestive problems, and I have a small insurer, and I went, and the receptionist welcomed me, and I showed her my insurer ID, and I got my appointment. Everything was fine. At the end, she made me pay like $30, and I think, well, this is fine. Like a week later, I received this gigantic bill of thousands of dollars because of this appointment, and I was like, what's going on? Nobody warned me about this. Like, I already paid. I mean, I thought I already paid, and then I call and they say, no, we were not able to give you the price before because this and that, and all of the system seems to be like so shady that's not how a free market economy actually works. You have to know the price before going to going to a provider, right? But those problems are not coming because of our free market system, but because of the government intervention in these areas.
Some people say that, well, the prices are only up because we've got these greedy pharmaceutical companies. They're price gouging everyone. So as a good country, we need to make everything free. So they stop doing that so people have affordable care. What are your thoughts?
If this is a government created problem, the idea that we're going to solve this problem by giving more power to government and by letting the state to intervene even more into the system is crazy. It's going to make everything worse, right?
It seems that everything you're saying about what's wrong with the healthcare system seems to be centrally planning. It seems to be socialism rather than capitalism.
Sometimes what they say is like, well, if we live in a capitalist country and the healthcare is like this, well, the problem is capitalism. We have to go to a more socialized medicines. So you start hearing people saying, we want all kind of free healthcare. We want free dentists. We want everything for free. And well, in Venezuela, you have some way like that. You have free of many of medical expenses, but you lose all the quality just to have the treatment. So it's neither of both. You actually need a free market system. When you know the prices, you know the treatment you're going to get beforehand, and you can choose where to go.
So the poor people in Venezuela aren't getting any healthcare anymore?
Exactly. Nobody's getting anything anymore in Venezuela. I definitely agree with a lot of people that this system, healthcare, are broken in many parts, but it is not because of free market. It's actually the opposite. It is because of socialism.